Well, a warm welcome to today's talk. It's still Monday the 15th of November in the evening. Now, I want to look at some things that are going on in terms of social organisational change today, which is a bit of a variation for this video really, but we'll also be looking at the complete lack of herd immunity and really quite significant disappointments in that regard, as it looks like we're now going to be endemic for quite a long period of time. It's not what I anticipated. I thought we'd reach herd immunity with the larger vaccinations and with the natural infection, but just look around you. We are not, and we'll be looking at why that is. Now, let's just start off with a bit of orientation, as we often do. So here we have the new daily confirmed COVID-19 cases per million in the more English-speaking countries. So again, we see Australia, Canada at the bottom, then the United States with quite a good reduction, but slight increase lately in the United States, actually for the last 8 days or so. Then the United Kingdom, likewise, a slight increase over the last week or so. Ireland, cases still going up, and Barbados, another English-speaking small island in the Caribbean or the Caribbean, depending on how you pronounce it. Also pretty high numbers, unfortunately. Now let's try and work out what's going on there. So share of people who've received one dose of vaccine. Now in Barbados, the problem isn't so much vaccine hesitancy as just lack of vaccine availability. So that's probably the main reason for that surge in cases in Barbados. Then the United States, then the United Kingdom, Australia, Ireland and Canada. That's people who've received at least one dose of COVID vaccine we've looked at there today. Now, new daily confirmed COVID cases per million. We're looking at Europe partly today, and well, what a quite a bad picture really in a lot of Europe. So United States, just by way of orientation, Germany, Bulgaria, Ukraine, United Kingdom, in that order. Then Greece, Netherlands higher cases, Ireland higher cases, Chechnya higher cases, Slovakia, Georgia, Austria, Croatia, and then Slovenia at the top with really quite alarmingly high numbers of cases. And most of the mainstream media simply aren't reporting on these smaller countries, which have got real difficulties at the moment, really severe, challenging situations. Patients in hospital, well, Bulgaria we see way out on top there. Now, part of this is probably reporting difficulties in some of these countries, but anyway, Netherlands, Ireland, United States, United Kingdom, Austria, Croatia, Chechnya, which Czech Republic, of course, Slovenia, Slovakia, but then we see a lot of hospitalizations in Bulgaria, an awful lot. And a lot of this can be explained by the extreme vaccine hesitancy there's been in Bulgaria. So I think we've got that share of the population fully vaccinated. So Bulgaria we see is actually way down here. So Ukraine, Bulgaria, Georgia, again, not so much a supply issue, a bit different to Barbados. This is more vaccine hesitancy. There's just been such a mistrust of authorities in a lot of these countries. Russia's much the same, just a mistrust of authority, which, looking at the history of these countries, you can understand. Even the recent history where there's still ongoing problems. But moving up, Slovakia, Croatia, Slovenia, United States, Chechnya, Greece, Austria, Germany, United Kingdom, Netherlands, Ireland. So remember, these are this is share of the population fully vaccinated. So very big gap there in these vaccine hesitancy countries, and explaining largely why there's such high rates. And we see this reflected in deaths as well. So, we think we've got problems in the UK and the United States, which of course we have. And these all are adjusted for population size. Russia is way higher. And of course, we know that Russia is greatly underreporting deaths. So these are the official reported figures. So there's a lot of people suffering in Russia at the moment, a lot. Hungary also higher deaths: Montenegro, Ukraine, Romania. Romania is actually down from its peak now, but Georgia, Latvia, and of course Bulgaria. Hospitals just completely overwhelmed in Bulgaria, and a lot of people dying. So not good in a lot of areas, of Europe. Not good at all as we head into autumn, and things have got the potential to get worse there for some time. So we are seeing a pretty variable experience of the pandemic around the world, even around Europe. So plenty of amazing graphics there in Our World in Data, which is where we got those from, so do check that out. Austria, as we looked at, very high increase in cases. 2 million people not fully vaccinated placed in lockdown. In other words, in Austria, if you're vaccinated, you're relatively free to carry on your normal daily life. If you're unvaccinated, you're essentially now in a lockdown. So we've got this very strong partisan thing in the population. People that are unvaccinated, found out in public, can be fined, I guess that's about 1,800, getting on for $2,000 US, 1,450 euros, which is about 1,300 English pounds, 1,400 English pounds. So huge amount of money, actually. It's a lot of money for people that breach this. The Chancellor is saying we are not taking this step lightly, but unfortunately it's necessary. And considering the increasing cases, you can see why the argument's being made. Because the great increase in cases and the relatively low vaccination rate. In reality, we have told 1/3 of the population we'll have to stay at home, apart from certain reasons. It's a massive reduction in contacts between the vaccinated and unvaccinated. So the vaccinated can mingle around to an extent. The unvaccinated can't. Initially for 10 days, but it looks like it's going to be ongoing after that. And children and the recently recovered are exempt, which does make sense because those that are recently recovered will have a good degree of immunity, at least for a fair period of time. So rationale for this is largely hospital-based. Medical University of Vienna. It's already projected that within 2 weeks we'll have reached the limit of ITU capacity. And not long after that, if things carry on, the limit of normal hospital bed capacity within 2 weeks. So this is kind of the doubling time. So of course what we have to bear in mind is that when cases are increasing exponentially like this, that things will increase exponentially, and in 2 weeks' time things could well be doubled. So hospitalisations could well be doubled, and in the case of Austria that would take it beyond ITU capacity and severely stretching ordinary hospital capacity, which would be overwhelmed in time if this step wasn't taken. As a result of this, what some may say is a draconian measure to basically lock down the unvaccinated, vaccinations have quadrupled recently, so it does seem to be increasing vaccination rates. Australia and Queensland, again, ban on unvaccinated visiting restaurants, pubs, sports events from 17th of December. So again, we're seeing this one rule for the vaccinated, another rule for the unvaccinated. Singapore, unvaccinated are going to have to pay their own medical bills from December. That could be completely ruinous, of course. So quite a few countries going for this marked difference in restrictions between vaccinated and unvaccinated. This is a major social implication for quite a few countries. Netherlands has entered kind of a bit of a light lockdown as well. Now, Office for National Statistics, this is the other sort of topic I want to talk about today, the disappointment with the way things are going, to be quite honest. So Office for National Statistics, huge antibody positivity rates. So these are people that would have tested positive for antibodies had the test been done on everyone in England over the age of 18. 18th of October. So 93.1% in England, 91.7% in Wales, 91% in Northern Ireland, and 92.5% in Scotland. And of course, the actual people that have been exposed to a vaccine or virus is higher than this because the antibodies with the testing used the detectability of the antibodies will drop below a certain level after about, what, 7, 8, 9 months, depending on the individual. And yet we haven't reached herd immunity. That's the point I'm trying to make here. Vaccinations reduce the risk of testing positive during both the Alpha and Delta period, the Office for National Statistics confirmed today. 2 doses of Pfizer-BioNTech vaccine reduce the risk of testing positive at the moment by 73%. Now, it was 80% in the Alpha period. Now it's only 73%. And likewise, 2 doses of the AstraZeneca, it's down to 62% now. So this is disappointing. And they also say that during the Delta period, that's now, two doses of either Pfizer-BioNTech or the Oxford AstraZeneca vaccine provide a similar level of protection to people who've had the natural infection. But given that there's such a difference between the effectiveness of the Pfizer vaccine and the Oxford AstraZeneca vaccine, I kind of find it hard to see how they can group these two together the way they do, but that's a direct quote from them. So I think basically the saying is that natural protection provides about the same level of protection as vaccination. And again, nothing like as much as we had hoped. It is very disappointing. I expected natural immunity to last for much longer than this. Now, it still does last for much longer in terms of protection of hospitalisations, but not from getting reinfected. And of course, if you're reinfected, you can be contagious and pass it on to others. This is the disappointing thing. Just to stress that point, UK Health Security Agency, which used to be Public Health England, why they have to say it's now Health Security, I have no idea. It sounds like a bit of an overcompensation syndrome. It's like any country with democratic in the title often isn't democratic, but anyway, I'll leave you to ponder that. Health effectiveness of Pfizer and AstraZeneca vaccine in preventing hospitalisations after the second dose. Now, top line here is the Pfizer-BioNTech. So it started off at 99.7% protection against hospitalisation. And after, what, 20 weeks? Yeah, after 20 weeks. After 20 weeks, that's down to 92.7%. So still reasonable, of course, that's for the Pfizer-BioNTech. For the Oxford AstraZeneca, though, down quite a bit, down to 77% protection against hospitalisation. So, again, either vaccine we're looking at, even in protection against hospitalisations, we're looking at a fair fall-off. 99.7 down to 92.7 for the Pfizer-BioNTech, 93.9 down to 77 for the Oxford AstraZeneca. Disappointing. The Moderna results similar in the States to the Pfizer-BioNTech vaccine, and of course the Johnson & Johnson was even lower than this one. So in the United Kingdom, this is why we're now going on to the booster programme. It has been under 50s, it's now over 40s. Are going to be eligible for a booster as their turn comes around at 6 months. And you can actually apply for this at 5 months. So you can get it to the day 6 months after your second vaccine dose. So it was medical workers and over 50s. As of today, it's over 40s. So it's this herd immunity thing that's so disappointing. Now, in the States, the CDC's basically changed its tune on this in the light of the obvious reality of the disappointment we're in. So originally we thought herd immunity would be 70%, then with the Alpha variant it's going to be 80%, now with the Delta variant it was going to be 90%, but now it looks like not even that might not happen. So we've had change in the transmissibility from the original increasing with the Alpha, increasing with the Delta. It's kind of reassuring that we haven't gone on to a massively more. It's still the Delta one that's the big, that's the virus now around the world. So kind of reassuring that we have had something that's even more contagious than the Delta. So does that mean the virus has reached the limits of its ability to mutate in terms of increased transmissibility? You know, it could well mean that. We don't know that, but it could well mean that. But it's encouraging that it's been stable, albeit this very high Delta transmissibility rate for a fair period of time. Another factor in the lack of herd immunity is, of course, we know that immunity is waning, whether it's from vaccine or natural infection. Varying social behaviours, of course. It's going to change things a lot. Breakthrough infections and infectivity. Well, people with breakthrough infections, whether it's after the vaccine or after natural infection, can still be infectious and pass the virus on with similar viral loads after vaccination to people that are unvaccinated. And of course, uneven international vaccine rollout, which leaves open the opportunity for further mutation in low vaccinated areas, or in high vaccinated areas, potentially the risk for vaccine escape variants. But thankfully, we're not seeing that at the moment, and I'm hopeful we won't. So Dr. Jeffrey Jones, CDC Epidemiology COVID-19 Task Force, he says herd immunity is very complicated. We agree, Dr. Jones, it is indeed very complicated. We were discouraged thinking in terms of a strict goal. In other words, is now talking down the likelihood that herd immunity will be reached. Some kind of threshold where there's no more transmission of infection may not be possible. Now this, in other words, let's get it clear. This guy's saying, Dr. Jeffrey Jones, CDC COVID-19 Epidemiology Task Force, is saying herd immunity may not be reached. We'll go on in this endemic phase for some time. So yeah, that's what he's saying. Some kind of threshold where there'll be no more transmission of infection may not be possible. Vaccines quite effective at preventing severe illness and death, as we've seen. None has proved reliable at blocking transmission of the virus. Transmission is still going on. Even if vaccination were universal, the coronavirus would probably continue to spread and be endemic. Now I'm sure if Dr. Jones was here, he'd say, he would definitely, I'm sure he would say, this doesn't mean, say, we stop vaccinating. Of course not. We need to vaccinate more. I believe that would be the CDC. Well, it is the CDC policy, of course. And I'm sure Dr. Jones would agree with that. Dr. Oliver Brooks, Advisory Committee on Immunisation Practice, need to increase vaccine uptake, he confirms. But he says that Dr. Jones's unexpected admission almost makes you less motivated to get more people vaccinated. Now, he's not saying that. He's saying that this could be a risk that people become disillusioned, and it is pretty disappointing. But Dr. Jones and Dr. Brooks from the CDC are both still encouraging vaccination. Who's this? Dr. John Brooks, Chief Medical Officer of the CDC COVID-19 response, says it's a science communication problem. Well, yes, I suppose it is. And he says it's important to predict. Sorry, it's impossible to predict what herd immunity will be in a new pathogen until you reach herd immunity. So, in other words, he's saying we haven't got a clue where this is, but we'll know it when we get there. So we know we're heading towards herd immunity, but probably not anytime soon. And oh, by the way, we'll let you know when we get there. So it's remarkably disappointing. CDC redefined success in terms of new infections and deaths rather than elimination of cases. So having assumed that we would get to herd immunity at 70, 80, 90%, now we're being told by the CDC that it's impossible to predict what herd immunity will be in a new pathogen. So they've changed the tune, definitely changed the tune until you reach it. This isn't what people have been saying up until a few weeks ago, but it is now. Don't want to be too downcast about this. What does this mean? Well, it means the virus is going to be with us for much longer than I'd anticipated, for much longer than we'd hoped. We hope at a lower level. We hope that, as we are seeing in people that are doubly vaccinated and in children, we're seeing that the symptoms are much more like headache, runny nose, sore throat, sneezing, rather than the coughing, difficulty breathing and fever. Although it can still present like that in some people and in the unvaccinated, of course, who are still at risk. But there again, we are getting vaccinated people going to hospital as well, but at much lower numbers. So the official teaching is we carry on with the vaccination programme, and when we get to herd immunity, the official bodies will kindly let us know. So this is going to be with us, albeit hopefully a much less dangerous level for a period of time, I'm afraid. It's an endemic phase. Now, we've heard from Nick a few times. Let's just to tell you the truth, I haven't listened to this yet, Nick, so I'm looking forward to what you've said. We've talked to Nick, who's had severe difficulties with his vaccinations, but he's overcome them. And bravery is not being scared. Bravery is being scared and still doing it anyway. So, but anyway, let's listen to Nick for a few minutes now. Thanks, Nick.
Hi, John and fellow Campbellites. It's me again, Nick from the south of England on the south coast. Just thought I'd come in and give you an update on my third booster jab. Just a little background about myself in case you're new or don't know me. I say I'm from the south of England. I'm 41 years old. I have a collection of comorbidities. I have myotonic dystrophy type 2, which is a form of muscular dystrophy, and I also have something called Graves' disease, which is an autoimmune condition that affects the thyroid, gives me hyperthyroidism. So I'm officially listed as clinically extremely vulnerable. Whether or not I'd actually get a worse condition than anyone else is obviously would be to find out, hopefully touch wood not. But my main issue is that I would have trouble being put onto a ventilator, or moreover being taken off of a ventilator due to my swallowing problems due to muscular dystrophy. And also the hyperthyroidism is a form of autoimmune disease, so that could well potentially blunten my antibody response to the vaccine. But my first two courses of vaccine were AstraZeneca. I had them at home because I'm extremely needle phobic. The first AstraZeneca shot I passed out on, as I do normally on vaccinations and needles. I've learned subsequently what causes this, and it's a drop in blood pressure, a vasovagal reaction. It's a nerve that runs through your body, and basically it makes my blood pressure drop and my heart rate drop to a point where my brain cannot stay conscious any longer, and I pass out, and it makes me feel horrendously ill. It literally feels like my life is drifting away from me, and when I come around I'm very confused for a good few hours afterwards, and can subsequently keep passing out again as well. So I learned that a way of dealing with this is to be lying on the floor when I have my injection to start off with, which the clinicians have been absolutely fine for me to do. My feet are up in the air, so it keeps my blood towards my trunk and towards my head. I then basically do what I do to stop my heart from lowering its blood from its BPM and from my blood pressure from draining, and that's by holding my hands together and pulling apart, and this causes your heart rate to increase and your blood pressure to increase, and it also stops your blood from pooling in your hands. So I'm happy to say for the third shot I had absolutely no feeling that I was going to pass out, which was fantastic. So my third shot was Pfizer's Comirnaty, which is a portmanteau of COVID, the phonetic pronunciation of mRNA, and immunity, so Comirnaty. I had that. The needle compared to AstraZeneca injection felt even less of a sensation than it did from the first two. And yeah, the clinicians, I asked if they would be happy to aspirate. As with all of the ones that have come out to me to do it at home, they look at me like I'm strange, as if to say, why wouldn't we aspirate? And of course they aspirated, no blood, all good. Definitely went into the arm. Within a few hours of having the Pfizer jab, it felt like I'd been punched quite hard in the arm. And that evening I couldn't really lift much. You know, I couldn't lift a pint of water or anything. It really, really hurt. I fell asleep that evening on the sofa like I normally do. Woke up at about 2 o'clock. Went to get a drink from outside in the kitchen, and as soon as I walked in the kitchen, my body temperature dropped because I had no heating out there, and that was it. For the next hour, I had absolutely uncontrollable shivers, rigors, shakes, whatever you want to call them, chills. I could not warm up. So I was well and truly expecting my temperature to soar after that. As I say, it lasted for about a good hour, and then it sort of slowly stopped. I stripped off all my clothes that I'd put on to keep warm and checked my temperature, and it was perhaps 36.9, and I'm normally 36.5. So it didn't spike as much as the temperatures I did from having the AstraZeneca jab. And maybe had I slept all the night through and not got up to get a drink, I may not have even been aware of that. So after that, all I suffered the next day, well, I woke up the next day feeling absolutely fine. Arm slightly sore. Sore arm lasted for about 3 or 4 days, and then that was it. My mum had her jab at the same time as her partner. My mum was just 1 day, 2 days earlier than the 6-month cut-off, but my partner was in. My mum's partner was in at the same time, and they said, you know, we can do you at the same time, which was great. And my mum developed the same sort of rigors as I did, but it lasted a good day or so. She's in her late 60s. She had AstraZeneca to start off with. We don't believe she's had COVID at all, and it did wipe her out for about 2 to 3 days. Gave her a bad dose of indigestion as well, and she was just quite fatigued and systemically affected by the vaccination. But she's really happy that she had it, and she'd much rather have had that than any reaction to COVID. And in complete contrast to that, her partner also had it, similar age, and had just a slightly sore arm, and that was it. Absolutely no issues whatsoever. So I'm happy to say I'm now 1 week into having my 3rd jab. Obviously going to wait a few more weeks before I can start mixing again in public and crowds that I don't know. But that actually leads me on to my next part, which is about mental health and post-pandemic stress, if you like. Now, without wishing to sound particularly dark or like I lack humanity, for me, the pandemic actually has been one of the most, it's been the best sort of couple of years of my life, because I struggle with dealing with society, with dealing with people. I'm not very good at being in crowds of people. I find that it's too overstimulating for me. And it just causes me to shut down and just want to get away. I can't cope with having more than one person in my house at the same time. You know, one friend. If another friend arrives, I will take myself out to another room and wait for one of them to leave. It's just something I can't deal with very well. So being in the pandemic, where it literally gave me a legal excuse to not be around people, was fantastic. Obviously, I wanted the deaths, the illness and all that to finish before it even started. I do not want to see any more of that. But as I said, for me, the pandemic, in terms of the isolation, has been superb, because I can't cope with people very well. And I really, really struggle with the idea of having to mix back into society and sort of live a normal life again, because particularly I see that the pandemic is still raging ahead, especially in the UK, and it's almost like most people around me are living their life as if it's not happening anymore. Now, that's not to say I'm scared. I'm not scared of becoming ill at all, but I am absolutely loving the fact that over the last 2 years I've not even so much as had a sniffle, which has been fantastic. No illness, no dodgy stomachs, nothing like that. So it's been really, really nice in that respect. So I can 100% say from now on ever, if I do have to go into the public and mix with the public, I will 100% be wearing masks indoors. That will be for the rest of my life. I'm never going to not do that. I think it's a silly thing to not do that. Why anyone would want to try and encourage an illness, let alone one that could potentially see you in hospital and, you know, mess your life up for a foreseeable future. It's just madness to me. So yeah, trying to keep it short and sweet and not waffle on too much. So I think we'll keep it there. I hope everyone stays safe. I hope you'll get your boosters done soon. I know I don't need to preach to any of you lot to get your boosters done. I know most of you will be either had it done or be waiting to get it done when your time is called. I'm of course taking back vitamin D again. I'm taking 5,000 IUs every day and have been since the beginning of September. And yeah, it's been an experience. But again, big thank you to Dr. John for your videos. I've not missed a single one. And I absolutely love the updates with Fafa from Africa. I think what he is doing and what you're doing with the channel is absolutely commendable. Yeah, just amazing. So thank you so much. I shall leave it there. Take care. Hi.
Thanks, Nick. Always an interesting report from Nick. So Nick's actually got that. There's like the main nerve in your body, the 10th cranial nerve. That the main parasympathetic nerve is this vagus nerve, and it starts in your brain and it goes down and it goes to your lungs and your heart and your stomach and your intestine. And it's what you call a parasympathetic nerve. Now, sympathetic stimulation will increase your heart rate and increase your blood pressure and vasoconstrict your blood vessels. Whereas parasympathetic stimulation will slow your heart rate down, reduce the contractility of the heart, slow your breathing down and dilate your blood vessels. Now, in Nick's case, he's got a very active vagus nerve. So when there's some stimulus, or even an emotional stimulus, then what can happen is vagus nerve will become overactive. And because the vagus nerve's activity is to slow the heart down and to lower the blood pressure, the increased vagal activity will slow his heart down and lower his blood pressure, and that can make him basically pass out and feel absolutely awful. It's called a vasovagal attack, so vasodilation caused by increased vagal activity, and it's not that uncommon. Quite a few people get it. I tend to get it with pain. So quite a lot of people, when they have pain, the blood pressure goes up. But there's a minority of people, and I'm kind of one of those. When I get pain, my blood pressure tends to go down, and I can't get up. I'm lying down, and every time I sit up, I start feeling dizzy. It's pretty inconvenient, really. Anyway, we've all got there's something wrong with everyone, I guess. So anyway, thank you, Nick, and appreciate the update, and thank you for watching.